Hello, my name is Joey. This is my trauma patient assessment video. BSI scene safety. Mechanism of injury is a patient that was ejected from his vehicle. I have one patient and I'm going to request ALS and fire at this time. My general impression is that this patient was flown out of a vehicle. He is on the ground. He's about 20 years old and he's a male. I'm going to check responsiveness. Hello, sir. Hello, hello, hello. Okay, the patient is unconscious, so I'm going to do a quick CPR check. Okay, he has a pulse, so CPR is unnecessary. I'm now going to move into my primary assessment, and I'm also going to consider cervical spine stabilization because this patient was ejected from a vehicle, suggesting that C-spine may have been injured in some regard. So an EMT is going to hold his head until we get into later on assessments. I'm going to check for exsanguination. I don't see any blood as of now. Later assessment may show blood under some parts of his body. I'm going to check his airway. I'm going to open his mouth using the jaw thrust maneuver. Okay. The airway is open and clear. It does not appear to be maintained, so I'm going to insert an NPA and with a BVM at 15 liters per minute of oxygen. I'm going to move on to my breathing assessment. So I'm going to cut open his shirt. I'm going to inspect the chest. I'm going to now palpate for any crepitus, deformities, or tenderness. That's a negative. I'm going to also take 2 lung sounds, the epilepsies. Okay. Lung sound suggests that this patient does have flail chest, and for that, I would give him a OPA with a BVM at 15 liters per minute of oxygen, but we've already did that in the maintain part of the airway assessment, so we don't need to do that. I'm looking for any sucking chest wounds, so I don't need to put any occlusive dressings on him. The patient is already stabilized, and a gas is already being provided with 50 liters per minute of oxygen. I'm now going to move into my circulation part of the assessment. I'm going to check all his voids for any blood. It's a negative on the head, arm, other arm, back, legs. Okay. No blood in any of the voids. I'm going to check both of his pulses.
That's available in my location for a tire change. We're going to be on the all-ramp on Jackson Avenue.
Pulses are strong. And I'm now going to check CTC. Okay, suggests that he has cool, pale, diaphoretic skin, which may indicate that he's going into shock. So shock will be in consideration, and for that we will consider 15 liters per minute of oxygen. Rapid transport, we'll keep him warm and we'll put him in the Trendelenburg position. I'm going to advise additional resources that this patient is a high priority, and I have found flail chest. I've given him an OPA and a BVM for that, and we're going to rapidly transport this patient. I'm now going to get into my rapid assessment. So I'm going to check his head for any fractures. That's a negative. I'm going to check his neck, the back of his neck, for any deformity, swelling, or tenderness. That's a negative. I'm going to look at the sides of both of his necks for any jugular vein distension. That's a negative. And I'm going to look for, at the front of his neck, for tracheal deviation. And that is a negative. At this time, the other EMT with me would help me apply a cervical spine collar to the neck of this patient, and he would still stay at the head for the later assessment when we need to log roll him and check his back. So EMT will still be here. The patient now has a collar on his neck. I'm now going to check his chest for any crepitus, deformities, or tenderness. Especially his rib area, that is a negative. now check 4 chest sounds, lung sounds. Lung sounds still suggest that this patient does have flail chest. I'm now going to move into the abdominal area with 1 sweep for AAA. I feel nothing. It's a negative on his abdomen. I'm going to check his pelvis for stability. Pelvis, it does not move, it is stable. I'm going to check his arms. Arms feel good. This arm feels good. Other arm feels good. Left leg feels good. And right leg. I'm feeling a bone that may be sticking out in his femur, suggesting a fracture, so we are going to split that. At this point, we're not going to log roll the patient. I will have another EMT with me tell me to do this. The EMT at the head would tell me the time to move the patient, so we will do that. 3, 2, 1. Okay, I checked the back. We're gonna put a back board under him now. Cervical spine from the back looks good, and the rest of the body for checking for any bleeding or exsanguination looks good. And patient is now on a backboard. I would attempt to take a sample at this time, but ultimately failed because he is unconscious and there are no bystanders nearby. I'm now gonna take vital signs for this patient. Starting with blood pressure. Patient's blood pressure is 100/80. I'm now going to check his pulse rate. Patient's pulse rate is a 64. I'm going to check skin condition. Skin is still cool, pale, and diaphoretic. I'm going to now check pupils. I'm going to open his eyes because he can't do that himself. I'm going to check the other eye. Okay. I'm noticing that the pupils are unequal. I'm now going to check respiratory rate. The patient's respiratory rate is 20, and I will now be moving into my detailed assessment. So I'm going to check the head, I'm going to check the scalp, looks good. I'm going to look through the cervical collar of any JVD or tracheal deviation or deformities of the cervical spine. That was already taken care of in a previous assessment, so Everything looks good. Collar is in place. I'm going to check his chest again for crepitus, deformity, or tenderness. Good. And I'm now going to also take 6 lung sounds. 6 places. What I forgot to do is check this patient's face for any internal bleeding, so I need to check his ears, his eyes, his nose, and his mouth. No cerebrospinal fluid in the ears. No cerebrospinal fluid. And open his eyes. Still unequal. Nose clear. Mouth clear. Okay. I'm now going to check his abdomen. I'm going to palpate 4 quadrants. Feels good. I'm going to check pelvis stability again. Pelvis is stable. I'm now going to check his arms with PNS. Okay, this arm is good. Pulse is strong. Rate is good. And I would attempt motor sensory, but ultimately failed because this patient is unconscious. I'm going to check this pulse. Strong and a good rate. MS failed. I'm going to check his legs now. This leg is good. I'm going to palpate this pulse. Pulse is strong. I would attempt MS again, failed. Palpate this leg. This leg does have a fracture. It is splinted, and I'm going to check his pulse on this foot. Pulse is strong, rate is good, and motor sensory failed because this patient is unconscious. I'm going to restate my general impression. This patient was ejected from a car, 20-year-old male. He has flail chest, so he has a BVM with an OPA at 15 liters of oxygen per minute. He has a right femur fracture, so we've splinted that at this time. The cervical spine has been stabilized with a cervical collar, and his pupils are unequal. I'm going to inform fire and ALS of the additional findings and let the arriving ambulance know that this patient is high priority. We're going to transport this patient rapidly, and we're going to reassess this patient every 5 minutes because he is high priority. And yeah, that is my patient assessment video for trauma. Yeah.